So sorry, we got cut off on the other screencast. So on this separate procedure, so here's an example. If you had an arthroscopic surgical debridement and a synovial biopsy of the right shoulder, they're performed on the patient who has a shoulder impingement. In this case, you can see 29805 is the separate procedure, and 29823 is the arthroscopic shoulder surgical debridement that is extensive. In this case, the coder would only choose and code the 29823 since the 29805 is considered the separate procedure and they were performed through the same incision during the same session. Therefore, the coder would only choose 298 or code 29823. Now, unlisted procedures, they're reported for surgeries when there is no specific CPT code available. I would really require or suggest that when a coder, before a coder bills out an unlisted procedure, maybe have a second look, have somebody else just make sure that another CPT code would not be more appropriate. When you do bill out an unlisted procedure, it is required that the billing department does submit the operative report or a special report. Now, the operative report, just the structure of an op report, you're going to have your pre-op diagnosis, which is going to state the diagnosis the patient had prior to the procedure. You'll see a post-op diagnosis, which was discovered during the procedure performed, which will be a brief description of the procedure by the physician, and coders should not code the procedure based on this brief description. It is very important they read the detailed description of the procedure. They should never code from the title of the procedure. And then you'll have maybe the physicians listed, the anesthesia, the indications for the procedure, sometimes the findings, and then of course that detailed description. Now, the description of the procedure, the physicians don't always specify the approach, but coders can look for certain keywords to tell them what approach the physician used. Say for abdominal procedures, physicians can choose an open or laparoscopic approach. Coders shouldn't assume an approach based on the title of the procedure. Again, they really need to look and read the detail of the description of the procedure, because the physician could state at the top that they did a laparoscopic approach, and when you read the detail, they really did an open. So it's very important you read the detail. So, for example, if the coder sees the words insufflated abdomen, they know the physician is performing a laparoscopic procedure, even if the physician doesn't say laparoscopic approach. The only reason to insufflate the abdomen is for a laparoscopy. If the physician does not document all the necessary information, say like lesions, the size of lesions, which we need for certain CPT codes, then of course the physician would need to be queried. So here's some tips for coding some surgical procedures. Hernias. If the physician is repairing a hernia using mesh, determine the approach if mesh should be coded separately, because with the laparoscopic hernia repair, mesh is included, but it is not included with an open repair. Physicians should also document if that hernia was reduced manually. A hernia is considered incarcerated if it cannot be reduced manually. Again, though, you would want the physician to document that. Physicians must clearly document the splenic flexure mobilization. CPT does include a code for mobilization of the splenic fixture. Hemorrhoid coding. The physician must document where the hemorrhoid originated. Was it internally? Was it externally? Code selection depends on the location, the type of ligation, and the number of quadrants. Coders can report internal, external, or internal and external. Breast lymph nodes. Differentiate between simple mastectomy, modified radical mastectomy. A simple means total mastectomy. The physician may biopsy a sentinel lymph node to determine whether the cancer metastasized. Sentinel nodes are always deep. Look for that documentation exactly how the physician dissected that lymph node, and if the physician biopsied any lymph nodes.